High-value care is a relatively new concept, but I think all health systems in the future will be moving in this direction. The main intent of high-value care is to make sure that we balance four things, and those four things are risk, benefits, costs, and patient preferences. The output, we would hope, certainly, if we're balancing that with our patients in every encounter, is two things. We would hope that quality would improve if we're using the right test at the right time for the right patient for the right reason. At the same time, we would expect that costs would improve as well. What's relatively novel for physicians is the concept of costs, and in fact, some physicians push back a bit, but costs really deals more with value, that when we do things for patients, we use resources, laboratory testing, imaging, etc., that we get value, meaning that there's a difference in terms of their outcomes, bang for the buck, more or less. I think it sort of starts with the readiness. Are we ready to build this program? Because if you build a governance structure at, for example, the system level and the site level, and you start delving into blood utilization, test utilization, full disclosure, there is a lot of work to build these programs, but there's benefits associated with it as well. The second thing is, do you have the resources to be able to do that? And so I think the classic situation for a hospital is, we believe that we need a high-value care program. We see that there's opportunities for improvement, whether it's in lab, blood, or other issues. Then do we do it on our own, or do we use an external resource? And in business, that's a classic sort of build versus buy decision. And I certainly can't make that decision for the hospital. But recognizing that this is a long-haul process, there are a lot of investments that are required in resources to be able to build it. I think a recognition of what those resources are and whether they can provide those internally or they need external help, I think would be another part of that readiness process. If you're not doing it today, everyone will be doing this in some form or another within 5 to 10 years. The same conversation I had with blood management 10 years ago. Eventually, everyone will need to have some sort of a process to ensure high-value care, because it gets more challenging in terms of resources that are available, constraints put on us by a variety of external forces, reimbursement, etc. So again, it's either you do it today or you do it at some point in the future.